CPR cardiopulmonary resuscitation is performed when someone's heart has stopped beating or they are not breathing. Here are the key situations where CPR is needed. When to perform CPR. 1. Unresponsiveness. The person does not respond when you tap them or shout, "Are you okay?" 2. No breathing or abnormal breathing. The person is not breathing, or their breathing is irregular, gasping, or very shallow. 3. No pulse. If you know how to check for a pulse, and you don't feel one, start CPR immediately. Steps to take. 1. Check for danger. Make sure the area is safe for you and the person. 2. Call for help. Call emergency services like 911 or have someone else do so. 3. Start CPR. Begin chest compressions if the person is unresponsive and not breathing. Use the CAB method. C. Compressions. Place your hands on the center of the chest, push hard and fast 100-120 compressions per minute, about 2 inches deep. A. Airway. Tilt the head back to open the airway. B. Breathing. Give 2 rescue breaths if trained to do so, otherwise focus on compressions. Important notes. If you're not trained, focus on chest compressions only until help arrives. Use an AED, automated external defibrillator, if available. It can guide you through the steps. Proper training is recommended for CPR to ensure effectiveness and safety.